let's talk about video games. People love them, right? But at what point does the hobby of playing video games become too much? The World Health Organization is now considering adding gaming disorder to a classification of mental health diseases in 2018. So what exactly do they consider the symptoms of a gaming disorder? When a person loses control over their playing habits, when they prioritize playing over other interests, and if they keep playing despite negative consequences on their lives and their work. Joining me now to break this down is our favorite clinical psychologist, Judy Ho, and we thought we'd set ourselves in a bit of a video game just to enhance the experience of all of this. Okay, so a gaming disorder, break down what that means and how it would show in a person's life.
Okay, Michaela. So actually, this is an issue really dear to my heart because I love video games. I think that they're really fun, and there's obviously positive effects of video games as well. The problem is when it becomes more of an addictive behavior.
This designation from the World Health Organization, what does that essentially mean? Does it mean that medical professionals can then start diagnosing people with this disorder?
Right. So if it does become adopted, you can then actually diagnose somebody with a disorder. And it's actually a step forward because when we have something diagnosed, then we can study its treatment, and that study will be funded. So we want to know what actually works for these individuals. And so I think that will be one consequence. The two things that make something an addiction is one, that it disrupts your brain's reward circuitry. So basically, anytime that you involve yourself in that activity or substance, your brain is lighting up in such a fast way that it basically encourages you to do those same behaviors over and over again in a compulsive way. And the second thing that we think of as an addiction is if somebody uses that to modulate their negative emotion. So, you're not having a good day, you're feeling a bit depressed, and the first thing you think about doing is going to play video games.
Right, because there's some escapism, right? I mean, all of us have ways we try to escape from the realities of the world. It's when you try to delve into that solely, I suppose. So you said the important word, treatment. It can be treated?
Absolutely. And what we know from early research is that cognitive behavioral therapy is the most effective way to treat video game addiction. So in this type of scientific therapy, we teach individuals to learn better coping skills that aren't of an addictive nature, better ways to take care of yourself, like mindfulness, getting out there, having a community. But also we teach them to identify those behavioral triggers when they're about to go down the path of self-medicating, if you will, with video games. And we let them know how to actually interfere with the triggers and to take their behaviors in another direction. And that's really going to be an important education for these individuals.
Judy Ho joining us. She's an avid gamer herself. Not everybody that plays video games is addicted. It's an important distinction to make because there's lots of ways it can actually help people as well. Judy Ho, thanks for joining us. All the best for you for the new year.